I think that the reason why it's so important not to judge is really twofold. The first is that it leads to some dangerous behaviors. The dangerous behavior primarily is assumptions and assuming that we understand where a person comes from and why they make the decisions they make. Similar to navigating a map, it can lead us in directions that leave us completely lost as a clinician, but also might lead us to lead our patients and our partners in ways that will leave them in grave danger in terms of clinical decision making. Just where we think that it's an economic decision, no, it's a faith-based decision that they're making. Or yes, we think that it's a family-based decision, no, this is actually a professional sort of decision they're making. So the first danger, I think, in judging is that we make assumptions. We're limiting how much information, and there's no communication in that. The second is that there's really no compassion in judging, and we tend to, it builds walls. It builds walls, I think, around our hearts and also around our minds in terms of being able to think clinically and effectively about what is going on. We're limiting the amount of data that come in to help us make the best clinical decision for as a partner in our relationships. And so I think the other aspect of it is that we have several decades, if not centuries worth of judging behind us. And we see where it's led us in terms of race, in terms of religion, in terms of gender. And it's led us really in some dark things that we continue to deal with, especially in Memphis, to housing and loans and the environment and waste processing. And those judgments, I think, that are based on very categorical relationships are limiting, not just as an individual, but in terms of society. So the injustices around socioeconomics, around gender, around race are, I think, further reinforced when even a clinician judges a patient.
Thanks for watching the IHI YouTube channel. If you liked the video you just watched, make sure to leave us a comment below and let us know what you thought. And if you haven't already done so, subscribe to our channel so that you'll know when there are great new IHI videos ready to be watched. You can also find us on Twitter and Facebook.